I'm Dr. Farhan Siddiqi, Chief Spinal Surgeon at FastMD. Today we're going to talk about cervical and lumbar fusion as well as disc replacement.
Dr. Siddiqi, what is a fusion or disc replacement?
Fusion and disc replacement are procedures that are done to reconstruct the spine after we have to remove a disc that's damaged. So if you have a disc that's damaged and collapsing, causing spinal stenosis or compression of your nerves, or a disc herniation, and that disc has to be fully removed because it's so damaged, we have to put something in its place. And those things that we put in its place are either spacers that fuse the spine or a disc replacement which continues to allow motion in the spine. In the cervical spine, it depends upon how much neck pain you have. So if you have a lot of neck pain, oftentimes we'll lean towards a fusion to stabilize the neck so the neck doesn't hurt as much. If you have primarily nerve symptoms like arm pain or spinal cord compression, a lot of times we'll use a replacement which still allows motion in your spine. In the lower back, it's a little bit different. It depends upon the stability of your spine. So let's say you had a trauma and your spine is unstable. You have something called a spondylolisthesis where the bone shifts back and forth, then you may need a fusion. However, if you have a stable spine, we might be able to put a disc replacement in.
Do I have to go to the hospital?
It depends upon which procedure you're having. In the lower back, one level procedures can be done in the outpatient setting, meaning same day surgery, you go home. However, if you have more than one level fixed in the lower back, oftentimes you have to stay overnight. In the cervical spine, that area is a lot smaller, so sometimes even up to 3 levels can be done in the outpatient setting. Easily, if you have 1 or 2 levels, you can have your surgery done and go home the same day. Potentially, you could even have 3 levels if you're really healthy, if you don't have sleep apnea, if your weight is well controlled, and if you don't have any breathing problems.
Will stem cells help me?
If your insurance allows, we will try to use your body's stem cells to help with this type of procedure. In the cervical spine, it can help the fusion heal. So we'll harvest your body's stem cells and we'll use them to entice your body to heal and fuse the bones together. In other areas of your back, if you develop something called adjacent level disease, meaning we fix one level and a few years down the road another level goes bad, your stem cells can be used to prevent that from occurring or halt it from getting worse.
What are the advantages of using my body's stem cells?
One advantage with using your stem cells is that we can harvest them and put them into a deep freeze. So let's say we harvest your stem cells during your procedure. We can use part of them during the procedure and the rest of them we can put into a deep freeze in our laboratory, something called cryogenic storage, and then they'll be there for the rest of your life. So let's say you heal really well from your surgery now. However, 3 years from now, you start getting symptoms at another level in your spine. We can thaw out a dose of your stem cells and transplant them with a small needle to help stop the progression of the new problem.
What are the success rates?
Success rates for these procedures are both pretty similar. If you have neurological symptoms such as sciatica, numbness, tingling, nerve pain into your legs or arms, buttocks, shoulder blade, the success rate of these procedures is very good. Probably 90 to 95% of people get improvement in those neurological symptoms.
Do my results vary depending on how long I've had this problem?
If you've had the problem a long period of time, let's say 5 or 6 years, your results might not be as good as if you have a new problem. So let's say you herniated a disc about 6 months ago. A lot of the damage hasn't set in a long-term setting. We can go in and fix the problem, and as I mentioned earlier, 90-95% of people get neurological improvement, and at least 80% of people get improvement in their back and neck pain. However, let's say you've had that disc herniation for 5 years. The success rate drops by about 3 to 5% a year, depending on how long you've had it. And that's because things like your ligaments and your muscles develop chronic problems like spasms and stiffness, and that limits your ability to recover from the surgery. So if you've had a disc problem, let's say 5 years, your success rate might drop by about 20% in comparison to someone who's had a disc problem for only 6 months. So we usually try to get you better without surgery in the first 6 to 12 months, but if it doesn't get better over that time frame, it's usually better to move forward with surgery sooner rather than waiting many years before you go forward.
What's my recovery like after surgery?
Really, we can do these surgeries nowadays in a fashion called minimally invasive. So instead of opening your back like we used to do in the old days, we use small microscopes and small incisions with special types of instruments to keep the incision as small as possible. What that does is it allows the incisions to heal quickly. These types of surgeries, the incisions can heal in 2 weeks, sometimes 3 weeks, something like that. After the healing of the incision is done, however, we do want to restrict what you do so you don't undo what we've done to repair your back and neck. So we do restrict you and make you wear support for your back and neck for the first 6 weeks. We restrict you to lifting more than about a half a gallon of milk for the first 6 weeks, and then between 6 and 12 weeks you can lift up to about 20 pounds.
When can I go back to work?
So if you have a sedentary job and you can adhere to those lifting restrictions, you can go back to work pretty quickly as soon as the pain from the incisions have been reduced. So let's say in the first 2 or 3 weeks your wounds heal and you're feeling better, you go back to work pretty quickly. However, let's say you have a heavy job like a construction worker or you're military, law enforcement. In those types of jobs, you probably will be off for 2 to 3 months because we won't be able to clear you to lift the maximum amount that you need to for your occupation.
What complications can occur during or after my surgery?
So of course, with any type of surgery, you can have complications. The complication rates in these procedures, especially when they're done in a minimally invasive fashion, are pretty low. Generally, in fusion or disc replacement surgery, the complication rate is 3% or less. So that means about 1 in 30 people can have a complication. That can be higher if you're older than 65 or if you have a lot of medical problems. Those complication rates can increase. In general, the complications that usually occur from either the anesthesia or from the amount of surgery that's done. So with anesthesia, you can have difficulty breathing afterwards, especially if you're a smoker or have underlying lung disease. If you do smoke, we really ask that you refrain from smoking surrounding surgery. We usually want you to stop before the surgery and don't return to smoking for at least 6 months. If someone does continue to smoke after surgery, there's about a 1 in 3 chance that you could get a wound infection and have to go back to surgery. And also the surgery failure rate is much higher. About 40% of patients that smoke, the failure rate is very high for them. So we try to prevent smoking during the surgical period. Bleeding is always another concern with surgery. Anything that thins the blood, such as aspirin, blood thinners, even over-the-counter medications like Excedrin, BC powder, things like that can cause your blood to be thin. And if it's thin, it can bleed. And bleeding around your spinal nerves can be very bad. It can cause paralysis. So we want to make sure that we avoid medications which can cause you to have a thin blood and bleed after surgery. If bleeding were to occur in surgery, we obviously have to return to surgery to get the blood out. Oftentimes after these types of fusion surgeries, you'll have a drain that collects the blood so you don't have to go back to surgery if any bleeding occurs. Sometimes that stays in overnight or even up to a day or two, which means you might have that overnight in the hospital, or if you go home, you might even have it at home and our nurses have to take it out at home. They're pretty small drains. They're about the size of like an IV that goes in your arm, so they don't really hurt when they come out. Infection is another concern always when we have surgery. A wound can get infected anytime you have an incision in your body. The likelihood of that is a little bit higher if you have diabetes, especially if that diabetes requires insulin. If the sugar is high in our body, the bacteria like to eat the sugar, so they will get into the wound to try to get to that sugar, and that will increase your infection rate. We usually use antibiotics around the surgery, and you might need it afterwards to prevent infection in the future. So infection is always a concern, and we want to try to prevent that by keeping your sugar down and keeping the wound clean afterwards, avoiding getting it wet when we shower, things like that. Another possible complication is something called a spinal fluid leak. The spinal fluid is a fluid that's made in the brain and travels down our spine and cushions all of our nerves. And sometimes the amount of compression of our nerves is severe enough that when we remove that compression, the fluid leaks from the nerves, and that can cause a bit of a headache. We usually glue that closed at the end of the surgery. The likelihood of that happening is pretty low, maybe 1%, unless you've had a lot of surgery in the past and we have to do surgery through prior scar tissue. In those cases, the fluid leak rate is higher, more like 5 or 10%. But if the fluid does leak, we usually glue it. And in rare cases, maybe 1 in 50 people that have a fluid leak sometimes have to go back to surgery to suture it closed. But overall, the likelihood of having a fluid leak, like I said, especially in someone who's having their first surgery, is less than 1%. The last complication that we always worry about is future surgery. So about 3% of patients per year will develop another problem in their spine. Let's say you have a herniated disc in one level in your spine and we fix that. There's about a 3% chance that the level next to it will wear out and you'll need another surgery within the first 12 months. That rate is cumulative. So it's 6% the next year, 9% the year after that. So over like a 30-year period, there's about a 90% chance that people will have additional surgery. So it depends how young you are. If you're really young and you have this problem and have to have surgery, there's a likelihood that you'll have another surgery at some time in your life. If you're older when you're having this surgery, the likelihood is lower because there's not as many years. So if we work on making our muscles stronger after surgery, our core muscles of our back, our neck, we can slow that rate down.
What are my next steps?
If you'd like to go forward with these types of surgeries, our next step for you would be to meet with one of our surgical schedulers. They will talk to you about the process. They'll also talk to you about getting cleared for the surgery. You'll need to have either our anesthesiologist clear you if you're relatively healthy, or you may have to have your medical doctors clear you if you have some medical issues. Some people have heart and lung problems and they have to see a specialist to get cleared for surgery. After that happens, you'll have some blood tests to make sure your blood counts are all in order, and then we'll be able to give you a tentative date. That date will depend upon your insurance and which facility the procedure is done at. Sometimes these procedures, as I mentioned, are done in the hospital and you stay overnight. Oftentimes they're done in the outpatient setting, like in our office operating rooms, and that all depends upon which insurance authorization we get. The last thing, of course, is that you'll need some pain medicine after these procedures because you will have an incision. Those pain medications we can electronically send by email to your pharmacy, and then we encourage you to pick that medication up as soon as possible so you have it at home. Oftentimes insurances need authorization, or the pharmacy may not have the medication, so you may show up the day of your surgery and they don't have the medication ready for you. So we really encourage you to get it ahead of time. We often encourage you to avoid 2 pharmacies, Sam's Club and Walmart, because they have a restriction on how much medication they can give you and you may not get a full prescription if you go there. In general, with this type of surgery, the state of Florida allows us to give you 7 days of medication. Realistically, I don't want you driving back and forth every 7 days to get another prescription. So what we typically do is write for a large number of tablets over that 7-day period, and that will usually last you a month or so at home. So be sure to pick that up early before your surgery so you have it at home ready for you. In rare cases, if you have a major spine surgery, you won't go home afterwards, you'll go to a rehab center. That's like a physical therapy center where you stay overnight, and they can do therapy with you 2 or 3 times a day over a period of a week or 2. If you're having a significant large spine surgery, we may have to have you go there, and then you'll get your medication from them until you go home.